fast enough.
March is Eye Wellness Month. Perfect time to focus on protecting your vision. From too much screen time to UV exposure, our eyes take a lot of strain every day. And tonight we're sharing simple ways to keep them healthy and sharp for years to come.
March is Eye Wellness Month, and it's not really something that's on the forefront of our brains whenever we're thinking about our health, but it's super, super important. I am joined by Dr. Monique Courtenay-Brown, and we are going to be talking all about eyes today. Thank you for being here.
Thanks for having me.
Of course. So before we dive into everything, I want to know about your background. You were the first female Black ophthalmologist in the state of South Carolina.
Yes, ma'am.
What did that mean to you as a South Carolina, born and raised, to have that title?
It means everything to me and my family to be able to come back and actually care for the people, for my people in my community.
Yeah.
So it means a lot.
So March is, Eye Wellness Month. And like I said, it's not really something we're always thinking about whenever we're thinking about our health. What does eye safety really mean?
Well, our eyes are extremely important. Like you said, we don't really think about it, but our eyes are irreplaceable. It's the way that we actually see and experience the world. Yeah. So if something happens, it's not always an easy fix. So prevention is most important when it comes to eye health.
What are some of those preventative things that we can be doing, even if we're not people that have struggled with eye problems in the past?
So you want to make sure that you're exercising, that you're eating well, that you're going outside and wearing those shades, or if you're doing sports, wearing goggles, or definitely any home improvement projects. You want to make sure you have something on for safety.
Definitely important. What are the common problems that people come in and talk to you about with their eyes?
So a lot of folks now, of course, are on the computers all day, every day.
Yes.
So eye strain is extremely important. I hear that all the time. Strain, dryness, blurry vision, and really there are simple ways that we can help them with that. So artificial tears, or even doing something called the 20/20 rule.
What's the 20/20 rule? I'm curious.
So with that, if you're on your computer all day, every day for work, after 20 minutes, focus on something about 20 feet away or so. And then give yourself about 20 seconds to look at that object. And that helps kind of replenish your eyes and reset. And then gives you a chance to actually go back to what you're focusing on.
Well, that's good. Some people don't really have the option to not look at their computers all day or not look at their screens all day because, like you said, our phones and our screens, it's the most important thing in our lives right now, whenever it comes to work, most of the time. So they start having eye strain, things like that, and they're experiencing, they don't really know if they need to be seeing a doctor yet. What are the good eye drops to use and the maybe not as good eye drops to use? I know that's a hot topic when it comes to eye care.
Right, well, there have been some recalls, so I always tell folks, if you want to look at a drop to get over the counter, make sure it's an artificial tear. Okay. Make sure it's a good brand. Don't go online and get anything.
Okay.
Because a lot of those aren't as regulated.
Thank you for sharing all of this with us. If people want a little bit more information or maybe want to see you at your practice, where can they find more of that information?
Yes, they can find me at lexmed.com. Just come online and they'll be able to book an appointment.
Awesome. Well, thank you so much, Dr. Courtenay-Brown, for being here and sharing all of this with us.
You're very welcome. Thanks for having me.
Of course.